Dr. McCullough, thank you for taking the time to join with me today. You've built a
Thank
reputation as
you.
one of the world's most published cardiologists with over 1,000 scientific papers to your name across cardiovascular medicine and public health. You've held leadership roles in research, clinical care, and medical education. And over the past few years, you've become known for your outspoken role during the COVID-19 pandemic. Your work, particularly around early treatment protocols, vaccine safety concerns, and the long-term risks associated with the spike protein, has placed you at the center of some of the most polarizing medical debates in recent memory. Whether people agree with your conclusions or not, your willingness to challenge the prevailing narrative has made you a significant figure in the global health conversation. Today, I'd like to cut through the noise and explore your perspective directly, from your critique of pandemic management to the practical protocols you've developed for prevention, early treatment, and recovery in the aftermath of the COVID-19 and their vaccinations. It's great to have you on.
Thanks for having me.
Now, Dr. McCullough, before we get into some of the wider discussions around public health and early treatment, I want to start with one of your more recent high-profile appearances. On May 21 this year, you testified before the US Senate Permanent Subcommittee on Investigations, sharing data that suggested a significant number of COVID-related deaths, up to 74%, can be linked to mRNA vaccines. Can you explain exactly where that figure comes from and how confident you are in the evidence?
In the largest autopsy series to date of people who died after the vaccines, when independently adjudicated, and I'm the senior author of the paper published in the journal Science, Public Health Policy and Law, we found 73.9% of cases indeed were directly due to the COVID-19 vaccine, with non-controversial vaccine injuries such as myocarditis, heart damage, blood clots, and other conditions which the vaccine manufacturers and the government authorities agree the vaccine causes these fatal side effects.
Yeah, well, you say non-controversial. There are some fact checkers, you could say almost all, and health bodies have disputed those claims, saying the data has been misinterpreted or lacks proper context. How do you respond to that criticism?
Every fact checker I've been able to find appears to be a vaccine promotional unit of some sort. Every single one. So if you go to factcheck.org, 100% of their fact checks are promoting vaccines. So I think what's going on is, the vaccine promotional apparatus, which is well funded, is actually operating these fact check networks.
So it's these lobbyists that are keeping this propped up.
I
Yeah,
think that's
well,
what's going on. Yeah.
yeah, well, we here in New Zealand had a particularly strong governmental response to the COVID situation. So I understand that you've actually taken an interest in what has happened here in New Zealand over the past few years, particularly around our response to COVID-19. Can you speak to sort of any involvement you've had here and whether that's been through speaking to groups, working with local organizations, or just observing how things have played out?
I'm well known to the Kiwis. I had lectured in the Auckland City Hospital, visited the North Island, visited the academic communities years ago. So I'm well known in New Zealand. And you're right, New Zealand took a particularly severe approach to the pandemic. New Zealand population is quite healthy. The virus was mild for the island. In fact, the islands, the North and South Island largely missed the Alpha and Delta waves altogether. So it was very mild. And what happened in New Zealand is, the greater injury that occurred in the pandemic was due to the vaccine. It was brought out in several documentaries. Many civic leaders stepped out. As you know, Jacinda Ardern stepped down. She got so caught up in the hubris. At one point in time, she said the government will be the single source of truth. I think she'll go down for making that statement as very similar to what a totalitarian leader would say.
Yeah, well, it's interesting you say that because there was a press conference right in the middle of the COVID situation, and Jacinda Ardern was asked by a reporter to say, "So you're saying there will be two tiers of society in New Zealand?" And she nodded and smiled and said, "Yes, that's exactly what I'm saying." And that was quite a big wake-up call for many Kiwis just to hear our leader say outright, there will be two classes of you, the vaccinated and the unvaccinated. And I think that was a big turning point.
Right, but why did she believe that the vaccines were going to work? This is very important. Remember when the vaccines were tested, there was just 1 month of getting shot one and shot two, primary series, and then there was just 2 months of observation. No one could have known by month 4 what was going to happen. And what we've concluded in a new book, myself and best-selling author John Leake, we've concluded in our book, Vaccines, Mythology, Ideology, and Reality, that what happened is Ardern and so many government leaders, they accepted this based on faith, based on a religious faith in vaccines, as opposed to science, because no one could have known. I mean,
Yeah, well,
she couldn't say, "Well, I know what's going to happen in 24 months." No one could. And within a few months of the vaccines coming out, our lead advisor in the United States, Anthony Fauci, said that boosters were going to be needed. The only reason why boosters were going to be needed is because the vaccines didn't work.
yeah, well, I think that's dead right. I mean, Jacinda Ardern, in the time, you could be generous to say that yes, there's faith in vaccines and wanting the country to be healthier. You could be generous there, but I think that in hindsight, it's quite easy to see that there was some sort of manipulation or financial control there, as we saw all over the world. Even talking about this right now in New Zealand is still seen as conspiracy leaning in a lot of ways, and uh, vaccine promotion is still full on here. They're still telling people to get the COVID vaccines, and many people, particularly my parents' generation, people in their 60s and 70s now, they're still bought and sold on it. They think it is the way to get around things, despite all the information that you've put out there and books like The Real Anthony Fauci. So,
Well, let me say, as a consolation to those who continue to take shots, I think they have gotten safer. Remember the spike protein, which is the spine on the surface of the virus. It looks like this. The spike protein is where all the lethality is in SARS-CoV-2. The spike protein was engineered in the Chinese biosecurity lab. Well, the vaccines make the spike protein. Pfizer, Moderna physically makes the spike protein. So the early versions of the vaccines were from the most potent spike protein that's called the Wuhan ancestral strain. And then the next strain that came out after that was a modified strain where they, jumped into the Omicron, which was far milder than the original strain. So the vaccines, because the virus mutated and got milder, the vaccines that followed it became safer. But in each case, the vaccines rolled out and they were already out of date. The virus had mutated to another strain. So the vaccines never prevented COVID. They didn't stop transmission. They were always obsolete. And the vaccines did not save any lives. That's the final false narrative that people are hanging on to. The vaccines grossly failed, but the claim is they saved millions of lives. Well, let me tell you, failed vaccines don't turn around and save millions of lives. It's a false narrative.
so in your opinion, why then did the entire world push them so voraciously?
In my book, Courage to Face COVID-19, we outline a biopharmaceutical complex, a very powerful vaccine cartel that's essentially coalesced over the years. And we think at the epicenter is the World Health Organization, the World Economic Forum, Gates Foundation, Rockefeller Foundation, Wellcome Trust, a vaccine incubator called CEPI, Coalition for Epidemic Preparedness and Innovation, Gavi, Unitaid. All the regulatory agencies have connections there. We have the suppliers, which are the vaccine companies. So they're suppliers. They're not driving the biopharmaceutical complex, but they are profiting big time. And this complex now is so strong. And, the World Health Organization, for example, wants to take over global control of public health. Why would they want to do that? Because they're running a biopharmaceutical complex. There is so much money to be made with mass vaccination campaign one after another that this complex, including CEPI, they're salivating over the next pandemic, which they call disease X. And almost every expert believes disease X will come out of another biosecurity lab. It'll be another man-made virus to get the whole world sick.
That sounds uncomfortably planned, to be honest. Gotta hope that it isn't. We had a huge uptake in vaccines here. It was population, like especially in the first couple of years, hugely trusted it. I myself, I got one at the start. It was a bit of a, panic decision, but for New Zealanders that are still dealing with the health concerns post-vaccine or after COVID infection, what would your message be? And are there steps that you recommend? I know that you have your protocols.
Mhm.
Feel free to go over those, or are there other steps as well?
Well, worldwide, the most widely used approach to cleanse the body of the effects of the vaccine and the infection is McCullough protocol base spike protein detoxification. It's peer reviewed, scientifically supported. It's the only one that exists. And fortunately, it utilizes over the counter products that you can use in combination. The lead three are nattokinase, bromelain, and curcumin. They're combined into a single capsule in some products. If you type in McCullough protocol in Google, 5.6 million hits are returned. Let me tell you, the entire world is doing this. The United States, I was the lead, but the former Frontline Critical Care Consortium, FLCCE, which is now Independent Medical Association, is using it. Doctors groups are using the protocol. Now, it takes a long time, and one has to target fairly high doses of nattokinase. We're now using 4,000 units twice a day and the other products in combination. But we see antibody levels to the spike protein go down, patients' clinical syndromes resolve, and they get back to good health. They just have to be, patient that it's going to take about a year or more.
Dr. McCullough, let me just step back a little bit for you. And can you explain to my audience just briefly about exactly what the spike protein is and what part it plays in all of this? Because it's one of these things that gets thrown around a lot, but I think a lot of people don't really understand the part it plays.
Well, let me show you the model again. This is the virus. The ball is the nucleocapsid, and the little spikes on the surface, that's the spike protein. So the spike protein is about 1,200 amino acids. It's coded for by about 3,400 base pairs. And, it docks with a human receptor called the ACE2 receptor. The S2, the inner segment, is sacrificed as the virus injects itself into the body. But when we get the infection, we all get the S1, the tip of it, stuck in our body. And when you take the vaccine, you get the entire length of the spike protein stuck in your body. It's not broken down by human enzyme. So the spike protein is something that gets in us. And there are some analogous proteins. For instance, if you've ever gotten Lyme disease, it's very hard to get that Lyme disease protein out of your body. It's called Borrelia burgdorferi. Another infection is hard to get out of the body is syphilis when it gets it. So this is one of them where we need to take supplements, nattokinase, bromelain, and curcumin. Thankfully, they're not prescription drugs. They're available, over markets all over the world. You can find them and take them in combination, follow the McCullough protocol. I have thousands of patients under direct observation, and slowly people are getting better. And, it's copyrighted in my name. And let me tell you what, if it didn't work, I would get pounded on social media.
Oh,
I
yeah.
guarantee people are merciless on these types of remedies. So thank goodness it's safe, it's effective, it works, and it's getting people well. And I have gotten broad credit for that. But I never patented it. I didn't want to have it be restricted in any way. Companies can make all different types of products and combinations to help people get better.
Thank you for that. And you fold those protocols into your work as the Chief Scientific Officer at the wellness company as well?
That's correct. So I'm in practice. I'm in my office right now in Dallas as an internist cardiologist. I serve as the chief scientific officer of the wellness company and president of the McCullough Foundation. So I wear three hats. Well, let me tell you what, the wellness company has really taken the world by storm. It's the only corporate entity that has officially said the vaccines are unsafe and ineffective, that people do need access to evidence-based both nutraceuticals and supplements and prescription drugs. as well as emergency kits. And so the Wellness Company now is a welcome resource in the United States and all over the world. And I don't know if Kiwis can access the Wellness Company. Maybe you know.
No, we can't, unfortunately. I have tried to pick up those packs online, but we're really blocked off to a lot of things. The only thing we really share with the US in that regard is that we can advertise on TV our medicines and pharmaceuticals, but other than that,
Hmm.
it's quite strict. But like, I follow your protocols, like I've told you for some years now, and as you've said, everything's available here if you want to go out and get it yourself and
Yeah.
start
Yeah.
that. So, and I think it's important to say it's as good for prevention as it is treatment as well, isn't it? So,
It is a Japanese, great credit to Dr. Tanakawa. Both nattokinase and bromelain are somewhat preventive against SARS-CoV-2. The other advantage to nattokinase is this anti-atherosclerotic. So if people are older and they've got heart blockages or blockages of other arteries, it's very wise to take nattokinase. It has additional effects to other drugs that we use. So what we advise people is, listen, go a year on the protocol. Check the spike protein, make sure it's going down in the bloodstream, and then if well tolerated, just continue indefinitely because the pandemic's not over. Sadly, continued vaccination has prolonged the pandemic. Remember, a viral pandemic should only last 2 years, and it should be extinguished. But the vaccines keep prompting the virus to mutate, and we keep getting new strains and prolonging the misery.
with that 2 year time frame, is that if it's effectively treated by medicine or just naturally?
Just naturally. I mean, Spanish flu was 2 years. No one expected this to be a 6-year pandemic. But the data are now clear. As people have taken the vaccines, the virus figures out a way to escape the vaccines. And the biggest jump was Omicron. Thankfully, from Delta, Omicron is a far milder strain, but the experts all agree that it was indeed vaccines that forced that evolutionary jump.
Mm.
But people just want this to be over with. They want the vaccines to be off the market, and put COVID in the history books. But what we're finding is people can't let it go. Government leaders will not discuss the COVID-19 vaccines, including those in the United States. And this whole campaign goes on. Sadly, the vaccines are purchased by governments. No one's taking them and they're thrown away. It's just a giant waste of billions of dollars.
Yeah, it is. And especially when countries like ours and like yours desperately need that money at home as well.
Mhm.
You've spoken about the safety signals linked to the mRNA vaccines, myocarditis, blood clots, neurological issues. How widespread do you believe these problems are, and are authorities doing enough to investigate?
There was a Zogby survey out a few years ago that just asked people by survey if they had a vaccine side effect. And the answer was 15% of people had a problem after the vaccine. The other
And that's a
source of
is that
data was,
self is that sorry, is that a self-diagnosed or
yeah, self-diagnosed, self-reported, but 15% of people don't feel right. And then we have the CDC VSafe data. That's where people responded after the vaccine with a more structured data form they filled out for the CDC. And shockingly, 7.7% of Americans were so sick after the vaccine they had to go into a clinic, emergency room, or hospitalized. So vaccine side effects are common, They're not rare. So one of the false narratives, and we see this approach taken in research, is there'll be a handful of spontaneously reported cases, and then it's divided by all the doses received, and then the calculation is, well, this is very rare. That's invalid because unless everybody is checked before the shot and everyone's checked after the shot, we don't have a valid estimate of incidence. And we know that people underreport side effects. So grossly underreported. For mortality, we estimate the underreporting factor is 30. So in the United States, our CDC has told us 19,400 Americans have died after the COVID-19 vaccine. That number is shocking because typically 5, 10, 15, 50 cases, a drug is pulled off the market. So to have 19,400 vaccine deaths logged in the government database, that's a shockaroo. But now multiply it times 30, we're looking at probably 560,000 Americans have died of the COVID-19 vaccine. Using different methods recently, Scientists Retsef Levi and Joseph Ladapo in Florida estimated about 500,000. They came in very close.
Wow.
This is terrible.
And that number probably extrapolates across populations that had similar vaccine uptake, I imagine.
That's true. In United States, we had lower uptake. For instance, USA Facts is a good website to follow. They take the CDC tabular data and report it. So among my group, Caucasian men in the United States, only half of Caucasian men took a vaccine and were fully vaccinated. 44% of African Americans were fully vaccinated. So the vaccine rates in the United States were far lower than what Americans were told.
Yeah, well, I know that we had a higher uptick than that, or maybe, like you've said, that was just what we've told. Who knows? But it seemed like at the time everyone was getting it, and it was sort of, silly not to. Or I think that people did want to have something to hang on to, some sort of safety net, something to lean back on. And when the vaccine was propped up as that, I can see why people did trust it. We've been conditioned to. But if they have done it now, they can also find your detox protocols. So these have been questioned a little bit online, I've seen. But what do your detox protocols involve, and what sort of scientific evidence does support those approaches?
Well, the first component is nattokinase, which is derived from the fermentation of chickpeas or soy. It definitely slices up the spike protein in intact cell and cell lysate models, as published by Dr. Tanakawa in Japan. So nattokinase, very solid. Bromelain, which is a family of enzymes derived from pineapple, also slices up the spike protein in preclinical models. So we believe that one is solid. Now, curcumin, the third component derived from turmeric, that's been tested in clinical trials of COVID and long COVID, and it improves symptoms. We don't believe it slices up the spike protein, but it blocks spike protein inflammation. So this has been published in combination in the journal, the Association of American Physicians and Surgeons, and the Springer Nature, a Curious Journal of Biomedical Sciences. We have one peer-reviewed paper published by my group of demonstrating, resolution of a syndrome and reduction in antibodies with the detoxification protocol. And I have thousands of patients under direct observation. So I'm very convinced that this approach is salutary. Sadly, the Biden administration spent $1 billion on long COVID. Not in a single application did they consider the spike protein as the cause of the problem, measure it, or measure antibodies to it. And of course, because they didn't go to the root of the problem, after $1 billion spent, not a single new drug was developed and not a single protocol was developed.
So if they had have been a little bit more thorough, they might have found things that you suggested, like hydroxychloroquine, ivermectin, and other combination therapies. What do you think is the strongest evidence supporting those treatments?
For acute COVID-19, hydroxychloroquine was our workhorse in 2020. About over 300 studies. It's modestly effective. A large study by Rialt and colleagues, I'm a co-author, demonstrated a mortality reduction in outpatients. A study by Henry Ford Hospital in Detroit demonstrated inpatient mortality reduction. So hydroxychloroquine, solid. Ivermectin, supported by over 50 randomized trials, bigger effect, probably a 50% reduction in mortality. Best quoted study is the ICON study published in Chest in 2020. And then we move on to other therapies. So these are very well supported. Wellness Company has them in their protocols for acute COVID. For long COVID, I use them selectively. Long COVID and vaccine injuries, if there's evidence of autoimmunity with the blood ANA test positive, hydroxychloroquine is the drug of choice. If there's a skin rash, craniofacial syndromes, or persistent pulmonary findings, then we use ivermectin. But for all the patients after COVID and after the vaccine, it's McCullough protocol, base spike protein detoxification with nattokinase, bromelain, and curcumin.
It's so good to hear such a clear path to how to move forward. I think I already know your answer to this part, but the large trials, large trials have dismissed many of those as ineffective or risky. And I'd ask how you respond to that, and if you believe these treatments were unfairly shut down or politicized. Like I said, I think I know the answer here, but
There were no large prospective double-blind randomized placebo-controlled trials of either hydroxychloroquine or ivermectin. And so far, the governments have had no prospective randomized trials of McCullough protocol based spike protein detoxification, none. So we're left with large observational comparative studies. So I quoted the Rialt paper, for instance, of, that one I believe had 39,000 individuals. There's a large, nearly 30,000 patient study from Iran with hydroxychloroquine. We had large studies done from Uttar Pradesh in India and in Central America with ivermectin. So we actually had much bigger data with ivermectin and hydroxychloroquine than we did with other products.
It seems that over these last couple of years, your focus has shifted more towards research, education, and advocacy. Has that left you much time still to practice with your personal patients?
Yes, I was busy with patients today. I, have a practice here in Dallas, Texas, and sadly, most of my patients have been damaged by the COVID-19 vaccines. Hundreds of cases of myocarditis and blood clots, neurologic injury. It's just heartbreaking to see people's health deteriorate due to mass vaccination. Very few COVID-19 cases now. Almost all of the problems people are suffering are from the COVID vaccines.
Yeah, well, I imagine you're a magnet for these type of injuries as well. Like if you were living in Texas and you had a COVID-related vaccine injury, you'd probably want to see Dr. Peter McCullough. I think that goes without saying.
Well, people fly in from all over the country. Fortunately, Dallas Fort Worth is a big airport. I've seen international cases, and I'm doing the best I can. Uh, we need more doctors to specialize in COVID-19 vaccine injuries. Countries like New Zealand, Australia, and France, they need to restore doctors' licenses that were, suspended because they didn't take a COVID-19 vaccine. Those doctors are the healthiest doctors on the planet. The same would be true for nurses. People who have taken the shots now have great concerns. And when I testified in the U.S. Congress over a year ago, under oath, I told the representatives that I expect about a 5 to 15 year window of concern. So if you took the shots in 2021, our research is still finding the vaccine in people's bloodstream and in their white blood cells with spike protein and DNA fragments. We're finding that now in 2025.
Do you think
So
we'll
this
see
is
medical professionals specialize into COVID, as a COVID specialization?
They already are. I can tell you, any doctor who's developing proficiency in handling the problem is seeing a ton of patients. Now, the medical orthodoxy should try to, capitalize on this. After COVID, there were long COVID clinics develop, and unfortunately, they focused on diagnostics like doing MRIs or cortical evoked potentials or other problems. So they spent a lot of money on diagnostic tests, didn't offer any therapy. And then sadly, one of the treatments they had for long COVID was to give a COVID vaccine and make the patients worse. And so these became very unpopular, and now virtually every medical center has shut them down.
Yeah, well, I think it's going to take a while to build back trust and to communicate clearly with the public again. And I mean, you've built a large public following, and that's come with a risk of your message being misrepresented or misused. How do you find navigating that responsibility, and how do you make sure people get accurate and balanced information?
Well, I founded the McCullough Foundation to deal with that. We have four major pillars. One is our independent scholarship, and virtually everything I say and write, I cite. I cite the data. You can find it, evaluate it yourself. No one else does. When I go to Congress, I cite the data. I testified last year just ahead of Anthony Fauci. So I asked the panel, how many citations did Anthony Fauci give? How much evidence did he use to support his claims? They said zero. Zero. I was grilled for hours, and I cited every piece of evidence. That's the reason why the American Board of Internal Medicine, simply couldn't touch my unassailable approach. So we have independent scholarship at the foundation, a big media operation. So we have multiple tweets and posts across all the platforms. Very busy YouTube channel, and our Substack Focal Points. which is widely read. It's the top biomedical Substack in the world. We're active in the courts. I'm an expert in nearly 100 cases right now in the United States and internationally. Been involved in cases that have gone to U.S. Supreme Court. And lastly, I'm very influential in public policy.
Mm.
So, we're at a inflection point here where I haven't been wrong. You mentioned Joe Rogan. One of Joe's quotes on my new book is Joe Rogan said, Dr. McCullough was right about everything.
Yeah.
And it turned out that the medical orthodoxy was wrong. When they said that vaccines were safe and effective, they were wrong. When they said the COVID-19 virus was unassailable, they were wrong. And we just keep going and going and going.
Yeah, and the frustrating part is they made all these mistakes and they were wrong every single time, but there's still no coming back to it and saying, "Yep, we got it wrong. This is it. This is how we're going to manage it next time." It's just one disappointing response after another.
I think it's because of personal use. This is very important. So if we were to go back in time to 1950, and if you and I were to express a concern regarding smoking, that smoking was harmful to the lungs and causes lung cancer, we would be in the tiny minority. We'd be dismissed by doctors and medical systems. They would laugh at us. They'd say smoking is perfectly fine. It's safe. Doctors advertise cigarettes. The tobacco industry funded, research, and doctors and nurses smoked. It's identical to smoking because when a doctor or nurse partakes in the activity, they have to, in their minds, convince themselves that it's safe. And then when the Surgeon General report came out in 1964 in Luther Terry, he called chiefs of medicine to Washington. He said, I have bad news. Smoking causes lung cancer. You should have seen the look on the faces of these doctors who are lifelong smokers. We're in the same situation where the doctors are, they're ignoring the bad news right now. Major medical centers, I'm sure Auckland City is no different. They're having no reviews of vaccine injuries, no grand rounds. They don't document whether or not someone took a vaccine or had COVID when they're seeing a new case of myocarditis or blood clots. And so they're trying to, in a sense, whitewash this out of medical history. And patients are furious.
Yeah, well, I think it speaks to a larger level of government distrust that maybe some people didn't want to admit to, because you have to admit that your government was lying to us on a grievous level, really. And I think that's hard for people. But looking ahead, I mean, what do you believe are the biggest unresolved health issues from COVID? I mean, we don't have to rehash all of it. We covered myocarditis and things like that. But we have the treatment gaps that people can fill with your protocols and through the wellness company if they can get that kind of thing into the country? Or is there something else entirely? So it's looking down the line, just wanting to know what people should look out for that could potentially be a side effect that they haven't noticed.
Well, long term, and we've already seen there's a recent paper out by Dr. Vibeke Manichi out of Denmark that's pretty clear. Mass vaccination has dropped population fertility. There's no doubt about it. We don't know for how long, but that is and that's for the vaccinated. The unvaccinated are fine, but for the vaccinated, population fertility has dropped. So that's one long-term concern. Another is what's called subclinical myopericarditis. That is little microscars that form in the heart. A paper in JECC by Koyuzmu and colleagues demonstrated that. So we don't know who has suffered some microscars in the heart after a vaccine and could die of a sudden cardiac arrest. The majority of vaccine cardiac arrests have no antecedent symptoms. They haven't seen a doctor at all. It's just boom, they go down. So I think that's a great concern. Another concern, which I think is equal for people who had the infection and the vaccine, is blood clots. I think basically virtually everyone is at increased risk of blood clots. I see blood clots every day in my practice now. I didn't take the vaccines, but I've had COVID several times. I worry about blood clots in myself. That's the reason why McCullough protocol-based spike protein detoxification is so important, because it works to dissolve blood clots and it's slightly anticoagulant. And I'd say the last area of great long-term concern, it's not verified, but great long-term concern is cancer. A paper by Bustos and Anguis titled The Multi-Hit Hypothesis of COVID-19 Vaccine Oncogenesis points out the vaccines through multiple mechanisms promote cancers. And now a paper, a term has been formed in these papers called turbo cancer. That is a very aggressive, rapidly developing cancer in someone who took the vaccines. I'm greatly concerned about this.
Yeah, well, that's going to be really hard to pin down to a vaccine later on, isn't it? When you're talking about these healthy people all over the world seem to be dropping from heart issues and all these kind of things. It's so hard to link it directly back.
Well, I can tell you, scientist Kevin McKernan is making great progress. So, in a man with colon cancer, he retrieved the cancer specimen and found the messenger RNA vaccine right in the cancer.
Oh, wow. Okay.
Okay, yeah, and so and for the heart, a autopsy paper by Crossan and colleagues from Harvard found the messenger RNA directly in the heart. So,
Wow.
we have been able to pin this down, and this is greatly concerning.
Yeah, well, I appreciate those citations. I'll put everything in the bottom of this in the description of this interview as well, because it really adds another level of authenticity. So, sort of as a final message for New Zealanders, when it comes to health, personal responsibility, and medical decision making, what do you believe people should keep at the front of mind?
At this point in time, the Kiwis should stop all COVID-19 vaccines. We have cases where someone tolerated the first five and died on the sixth shot, for instance. So all vaccines should be declined. Virtually everyone on the North and South Island should consider McCullough protocol, base spike protein detoxification, nattokinase, bromelain, and curcumin in combinations, available on Amazon or anywhere online. I think virtually everyone ought to consider that. And then, very importantly, patients at this point in time need to be vigilant. They took a vaccine, they're at risk for heart problems, blood clots, even potentially cancer. So don't sit on any problems. Immediately seek attention. Put yourself at risk by taking the vaccine. And then in the future, don't be fooled. We've been told by this biopharmaceutical complex that there's going to be a disease X. It's coming out of a biosecurity lab. I think everybody should understand the next pandemic, the answer is not a vaccine. We should never vaccinate for pandemics because all we do is cause the virus to mutate and get past the vaccine. We should focus on early treatment. We should always have a focus on early treatment. So in New Zealand, if there was an outbreak of an unknown disease, the first question to ask is, how do we treat it? And let's get treatment centers going and decline or defer on vaccination.
Yeah, well, that's great advice, and I hope there is the option to defer on the vaccination when or if it does come forth, because there wasn't such an option last time. I just wanted to finish off with a quick couple of sort of rapid fire questions that I had set up for you before I let you go. I know we're coming to the end here.
Mhm.
So this is just a couple of sort of myths that floated around during the pandemics. Number one, and a big one, was the N95 masks, and do they effectively stop any COVID transmission?
No, they don't. Masks have been disproven in a Cochrane analysis. So we should only wear masks when we go into respiratory isolation as a doctor or nurse so we don't spread bacteria onto the sick patient.
Actual droplets, usually, isn't it?
Correct.
So 2 meter distancing between people, like we all did at the supermarket, did that have any effect?
No, it's not evidence-based. The data suggest almost all the transmission occurred at home. So you have to be around somebody at least 3 hours or more, and it's almost always at home.
Okay, great. And what about the lockdowns? Did they reduce COVID mortality in the long run, do you think?
No, the only people who should have quarantined were the sick people. Locking down healthy people is not a way to handle the pandemic because the healthy people, they're not sick. So only the sick people have to stay away from others.
It makes an odd kind of sense. Asymptomatic spread. How significant was the risk of people without symptoms transmitting the virus?
Pure asymptomatic spread didn't occur. As a paper by Cow and colleagues, A huge study from China disproved asymptomatic spread, but pre-symptomatic did. So as people started to come down with it, they could spread it. They knew something was wrong. If one, was sufficiently ill to get a test, that's probably a proxy that they could transmit it.
Hmm. And lastly, the PCR testing that we had, the particularly uncomfortable up the nose swabs, was that reliable for identifying active COVID infections?
PCR testing was overutilized and inappropriately used. We don't have to put a swab way up in the nose. Remember, it's so contagious that it's right here. It's right in the front of the nose. So never let anybody put a swab up your nose except for yourself. The PCR test, if it's kept at a low cycle threshold, or CDC recommend below 25, it was reasonably useful. But once the antigen testing came out, we should have had confirmatory testing, just like we do in HIV. Both in this case, it would be PCR testing and antigen testing. Because people had to quarantine and there was concern, we always should have had confirmatory testing. So with the testing, we estimate the United States, the 1.2 million COVID deaths that were declared in the National Center for Health Statistics data, only half of them had a pneumonia. So you can tell the PCR test was false positive or inappropriately applied. Remember, a PCR test can be positive for months afterwards. So they were grossly overutilized, inappropriately utilized. And if we learned anything, we should adjudicate cases. If we would have adjudicated cases, my estimate in the United States is we would have ended up with 120,000 COVID-19 deaths. Sadly, we've ended up with well over 500,000 vaccine deaths.
That's really quite a sad note, but can still finish on it. Dr. McCullough, I really appreciate you coming on today. It's been hugely informative, and I think our New Zealand audience is going to really appreciate this. One of your quotes that I'll sort of end on here that I saw online and I repeat to people occasionally is you said, everyone needs a second opinion when they hear just one narrative. So I think that's a great note to go out on. And is there anything else you'd like to say?
No, you gave the second opinion. You gave the narrative. Make sure you follow me on social media. Sign up for Focal Points. That's the leading medical Substack. It's free. Get an email every day. Check out my new book, Vaccines, Mythology, Ideology, and Reality. It's on pre-purchase right now on Amazon. Visit my podcast, America Out Loud Talk Radio, McCullough Report, and follow me all over social media and follow the common ground. I'm Dr. Peter McCullough. Thank you so much for having me.
Thank you, Dr. McCullough. Have a good day.